All right, well, here's a story you're not going to see on the mainstream media, the big corporate bought and paid for media, the news networks, because it has to do with the little guy getting screwed once again by the greedy corporations. And all of those big channels are all run by big corporations, so they don't cover this type of story, and you're not going to see it. But it's about the American worker, because for years, big corporations and insurance companies have been doing this even before the pandemic, which has been gutting workers' rights, which is, thanks to the pandemic now, those cuts, all of the things that those big corporations were trying to do are now showing their ugly face. As workers go in and try to claim workers' compensation for getting sick or injured or something else on the job, they're met with like a brick wall. Let me tell you what's happening on this, and it's really troubling. And this is just happening at big companies all across around the country. We're going to talk about the federal workers. That's just one piece of this. 4,000 federal workers have gotten COVID. We'll tell you how they fare on this as well. And it's not good. Basically, The Intercept has been doing some amazing journalism on this. They report that numerous COVID-19 workers' compensation claims have been held up by employers, basically stonewalling them, and insurance companies. And insurance companies just keep dragging their feet. They keep dragging their feet, and they basically don't answer their claims. Yeah, that's right. Insurance companies go out of their way, of course, we all know this, to try to not pay claims, or how if they can find loopholes to say that, no, you're not covered for that. You're not covered for that. Basically stonewalling employees' abilities to get benefits after they get sick at work. So specifically on coronavirus. Now, you now may be wondering this question, right, which is, well, do these companies, insurance companies, have any kind of a leg to stand on? That's a good question. You know, do they have a good leg to stand on in this to say, hey, we don't know if you got sick in our office. We don't know if you got sick while you were working here in this building for 16 hours. We don't know. So that's a little bit of a loophole in this. And they're able to hide behind that. Well, as you're thinking about it for a second, I want to use an example from the Daily Cause and help you answer that. Her name, this is a perfect example. Her name is Virginia Legge, and she's a corrections officer in Hartford, Connecticut. She spent 3 weeks fighting for her life after she got coronavirus. She got sick at work after working a 16-hour shift at the prison. Okay, 16-hour shift at the prison. She would go to work and home. She wasn't hanging out anywhere else. She was going to work and home. She didn't get sick at home. She got sick at the prison, where we knew there were outbreaks all across the country at prisons, right? We saw what happened in Kentucky and other places where there were just massive outbreaks. There was worried that it was going to be spreading amongst the community because of that. Well, she goes home. She then files for, she's trying to file for workers' compensation to be able to pay for some of this, and no luck. Stonewall. So if you had to guess where she got sick, do you think she got sick at home or at the prison? I think my money would be on the prison. Let me know in the comments below what you think. And she's still waiting on any information from her insurance company on whether or not she'll be able to file a claim or get any money to take care of her medical bills. Think about the people that have, and think about the poor people who have lost their job and now they don't have any health care benefits, on top of not being able to file workers' compensation benefits because they got sick at work. For years, big employers like Walmart and others have worked really hard to cut back on workers' compensation. They've been trying to maximize their profits while trying to push risks onto the workforce. Basically saying, you as the worker, and this is where we need a stronger union presence in this country. Do you know that 45% of Republicans support stronger unions in this country? You wouldn't think that, though, if you watch the big corporate media, you'd think that Republicans are against unions. They're not. They're not. 45% of Republicans support strong unions. You know what you get when you have strong unions? You get better worker compensation rights. These are the types of things that get squandered when big corporations run amok over people. This example, if someone ever says to you, we don't need unions in this country, this is a perfect example of why we do. Stronger unions lead to better wages for workers and better rights for workers, more justice. And this is a perfect example of it. Well, the biggest issue in all of this, of course, is the loophole issue, right? It's the COVID-19 issue. It exposes one of the great loopholes in this worker compensation claim issue right now, because viruses can be caught outside of work. So how do you know? How do you know that you've caught it at work? How do they know, and how can they cover it? Well, the example that The Intercept gives in their reporting is that things like black lung disease are really only caught by coal miners, right? They really only get black lung if you work in a coal mine. Pretty easy to figure out, right? But corporations have managed really to cast a lot of doubt as to whether or not you got COVID-19 in the office. And again, this is why Mitch McConnell and his Republicans want liability protection for businesses as the number one thing that they've been pushing in their stimulus. Liability protection. That's all they've wanted. That was their priority number one. Not direct payments to you, not health care for you, not anything else for you, just liability protection for the big businesses. They already have enough of it. Here's a perfect example of how they have enough of it. Here's another example on this heartbreaking story. This one really touched me. Kaiser Health News reported this story. 51-year-old James Anderson, 51 years old, healthy, a married father of 2 small children who contracted and died of COVID-19 in April. This was back in April. His job was to replace air filters on COVID patients' rooms at hospitals in suburban Pennsylvania. His whole job was going into patients' rooms who had COVID and replacing the air filters so that they would not continue to push COVID particles all around the hospital. He had the unbelievable job of having to take that nasty air filter out of there. He gets sick and dies. That was his job. When his family mourned him, of course, tried to figure out what to do next, they were denied his workers' compensation death benefits by the St. Mary Medical Center. They are still being sued for it. St. Mary's Medical Center is being sued for it. They deny that his workers' benefits were denied, but they're facing a lawsuit because of that. That would be dismissed very quickly if it was cleared that he actually received or their family received workers' compensation benefits. You think his family's making that up and they'd actually file a lawsuit and spend the money to hire a lawyer if in fact that wasn't true? Anyone who knows anything about the law knows that you don't want to waste time or money doing that crap. He worked there for 23 years. 23 years. At that St. Mary's Medical Center. That's how he was rewarded. That's how his family was rewarded. Again, we're just numbers on a paper, right, to these big corporations. They want to push those profits higher and push workers' rights down. But it turns out it's much different, though, if you work for the federal government. So if you are a federal employee, how many people watching right now are a federal employee? Thousands of federal workers say they've gotten COVID-19 on the job. And guess what? Because of what we passed back a number of months ago, the Federal Employees Compensation Act program by the Labor Department announced in March as part of the COVID-19 and the CARES Act, that for workers at high risk of being infected on the job, such as first responders, public health and medical workers, or law enforcement, they would quote, accept that the exposure to COVID-19 was proximately caused by the nature of the employment and will only require medical evidence that establishes a diagnosis of COVID-19, such as a positive test result. So I know that's a lot of speak and mumbo jumbo, but all that means is that if you're a federal worker, they're going to allow you to say, hey, I got a COVID test. It's positive. I probably got it because I worked on the job. Great. Enough said. Here's your benefits. We'll take care of it. Federal jobs. Corporate jobs? No. Private, public sector? Totally different. There are significant, think about this. There are significant long-term health problems that people have, even if they get over COVID. We know that there's diminished lung capacity. We're hearing of trouble in the brain damage as a result of it. There can be all kinds of problems as a result of having COVID and recovering from it, but never fully recovering from it. Not to mention insurance companies that spend all of their waking hours trying to find loopholes in order to not pay you. So that's the American worker. Good luck trying to get some sort of workers' compensation benefits if you get sick on the job, if you're a frontline worker or you work in one of those high-profile positions when you're at the hospital, you're working at a prison, you're working at a meat packing plant, which certainly we've seen massive outbreaks there. What rights do those people have? They can't stay home. They can't stay home because they need that money. But if we had a stimulus that worked for everybody, which would allow people to say, you know what, I am not going back to work at that chicken plant where everyone else has gotten sick. I'm not putting my own life at risk just so I can package chicken so I can put food on the table for my kids. This is the disgusting part of this. This is the deep underbelly of this, which is that the low income worker, trying to stay in that job in a high risk environment. And if they get sick, they have no recourse. They can't get benefits, health benefits, to be able to provide them with the treatment that they need at the hospital. Then they have medical bills that skyrocket and they can't pay for it. And we're seeing medical bankruptcies on the rise. This is all part of this vicious circle. And Mitch McConnell wants liability protections for big businesses as his primary factor inside of the new skinny stimulus. It's still even there. Big difference. It's all part of it. Let me know in the comments what you think about this. Smash that like button. Please subscribe to the channel. Don't forget, every day we publish our newsletter. You can read more of the news that you're not going to see on corporate television. Morninginvest.com is how you subscribe. Totally free. You can read it in about 5 minutes over your cup of coffee in the morning. So thank you so much.